Hello, all my Lyme warriors out there trying to navigate their disease and reclaim their health. Today I wanted to talk about co-infections. Co-infections make the Lyme disease picture even more complicated. Um, Chances are you may have a co-infection yourself, and you may or may not have tested for it. You may or may not be aware of it. There was a survey done in 2014 with over 3,000 patients that showed that at least 50% of them had one co-infection and 30% of them had two or more. And in that study, they didn't look at every single possible co-infection, so it could be even higher rate than that. So what is a co-infection? Well, we know that the Borrelia bacteria is the one responsible for Lyme disease. That's one of the bacteria that ticks transmit. But I think of ticks as the dirty needle of nature. They're jumping from one animal to the next, picking up multiple viruses and bacteria and maybe some fungi. They're kind of picking up different parasites, a little bit of everything, and then they're transmitting that to their next host and their next host and their next host. So it's not usually a clear cut just one bacteria that you get. It's usually a little mixture of things, and it's important to look into that to see what co-infections you might have because it's really important for your healing. So you might have some symptoms that are attributed to the Lyme bacteria, but some of your symptoms may be attributed to something else. And then it's not really a clear-cut picture because you could have joint pain and fatigue that are caused by more than one thing. It could be hard to kind of pinpoint exactly which bacteria or parasite your symptoms are coming from. So I recommend doing a full panel looking at various things. The other thing is, even if you don't get the parasite or bacteria or virus from the tick itself, just you now being an immunocompromised host are more likely to pick up opportunistic infections. So if you've had Lyme disease for a while, your immune system is really stressed and it's not quite as strong as it previously was, so you're more likely to pick up infections that you may have been able to fight off before. So co-infections are something really important to look into, and they're something that can feel really overwhelming when you get the diagnosis of Lyme disease. That's complicated enough, but if you now have various parasites and bacteria and different things affecting your body, it can seem very overwhelming. And I've been there. I've had multiple co-infections myself, and we can get through this. There is hope. You can sort it all out. It's usually complicated. It can take a while to get everything sorted, but if you know what you're dealing with, you know what to expect, that can make the process that much easier. So what are the most common co-infections that come along with Lyme disease? Babesia is one of them. Babesia is a parasite, and that one is most typically associated with night sweats, shortness of breath, and racing heart. Bartonella is another common one. The hallmark symptoms of Bartonella are skin rashes and foot pain, so especially the bottom of your foot, intense pain there. It can also lead to some, psycho kind of effects such as anger and anxiety, that kind of thing. So those are pretty common with Bartonella. There's Ehrlichia, there's Rocky Mountain spotted fever, there's anaplasma, mycoplasma, tularemia, Q fever, chlamydia. There's different viruses like the human herpes 6 virus, Epstein-Barr virus, which is the virus known as mononucleosis. That one is usually associated with extreme fatigue. There's also mold, and you can have mycotoxin buildup. So mold and Lyme disease are commonly occur together. So we can talk more about mold in the future because that tends to be a big one for people. Also Candida. Candida tends to be an issue with a lot of people with Lyme disease. Different protozoas, different parasites. So I personally, along with Lyme disease, I also tested at various different points during my treatment, during my journey. I tested positive for Babesia, for Bartonella, for parvovirus, Epstein-Barr virus, cytomegalovirus, human herpes 6, Candida, protozoa, toxoplasmosis. I had a parasite called Blastocystis hominis. So I've been there. I don't think I even covered all of them, but I had multiple co-infections, and I know how it feels so overwhelming and so depressing, really, when you see all these tests and you're just like, how could I have all of these things wrong with me? How can I just be overcome with so many bugs? It gets to a point where you don't even feel human anymore. You don't even feel like yourself because you're just covered with these other entities that are taking over your body. And if it makes you feel any better, humans have more bacterial cells than they do human cells in their body. So we're taken over with more bacteria than we are human anyway. So part of that colonization is normal, but it's just the balance of which bacteria are good for you, which ones are, taking over that really shouldn't be, getting everything into balance. And the little bugs do affect your health. They affect your mood. When I had candida, that was just like really taking over. I had intense sugar cravings because these little bugs, they want sugar to feed them. So they they want the host to eat sugar, and they're responsible for those cravings. So it's easy to get discouraged. It's easy to feel like you're not in control of your life and you're not doing, your diet perfect, everything perfect, because you're having these cravings, you're having, things that are out of your control. And so I just want you to take away that it's okay. It's okay to feel that way. It's okay to not fully be in control. It's hard to be 100% disciplined all the time, but even though it feels overwhelming and it feels hopeless at times, if you stick through it, if you do diligent testing and figure out what's wrong and take care of one pathogen at a time and really focus on your immune system, building your immune system up. If you can build your immunity up so that you're more resilient and less likely to pick up other infections and more likely to take care of the infections that you have, that's really going to be your best defense than just going in and just killing, killing, killing. So it's a complicated picture. There's a lot to it, but I do want to let you know that there is hope. You can get through it. I was able to get through all of these co-infections even when I felt hopeless and so fatigued and didn't know where to turn. And so it is a complicated picture, but with some personalized health coaching, you can really make some headway. So I'll go ahead and stick a link in here to a breakthrough call with me. If you think one-on-one coaching might be a good fit for you, I do have a little bit of room in my schedule right now to take on a few new clients this month. So I will go ahead and stick my link on this post, and you can feel free to schedule a breakthrough call if you think I am a good fit to work with you. Thank you, and I will talk to you all later.